Hi everyone, you are welcome back to my channel. In today's topic, we'll be talking about transmission-based precautions, and we'll be looking at 4 precautions that we should take when taking care of clients. The first one is the standard precaution. The standard precaution is a set of guidelines that nurses need to take when taking care of someone, and this is to prevent transmission of infection from the one client to another, and also transmission of infection from the client to the nurse. And the example include wearing of your gloves when taking care of clients, wearing of gown when you're taking care of clients with splashes of blood or body fluid, and also proper disposal of needles and sharp objects. Those are the standard precautions that you need to take. The other precaution we'll be looking at is the airborne precautions. These are the disease condition that falls under the airborne precautions. We have measles, tuberculosis, varicella zosters, which is chicken pox, and at adulthood we have herpes zosters, which is the secondary of chicken pox. So the way to remember this one is using MTVH. So M as in measles, T as in tuberculosis, V as in varicella zoster, which is otherwise known as chicken pox, and H as in herpes zosters. So if you have clients with this disease condition, the nurse needs to put the client in a private room with a negative air pressure, and the nurse, when entering the room, you will need to put on your N95 mask. And if the client needs to leave the room, the client will need to put on his or her face mask. And also we need to keep the door closed at all the time. So the other precautions we'll be looking at is the contact precautions, and the example include multi-drug resistance, respiratory infection, skin infection, wound infection, enteric infection, eye infection. And the easiest way to remember this one is Mrs. W. M as in multi-drug resistance, R as in respiratory, S as in skin infection, W as in wound infection, E as in enteric infection, and E as in eye infection. So if you have clients in these kind of precautions, what the nurse needs to put on is the gown, the gloves, and you put the client in a private room. These kind of clients can also cohort with other clients with the same precautions. So as you can see in what I wrote here, under the skin infection, it also have a subcategory, which is varicella zoster, herpes zosters, impetigo, pediculosis, and scabies. This also is under a contact infection. As you see that herpes zosters and varicella are also in airborne precaution. So if you have a client with varicella zoster and herpes zoster, you maintain a airborne and a contact precaution for the client. The last precautions we'll be talking about is the droplet precautions, and it has a bunch of disease conditions that we will need to cram, which is the sepsis, scarlet fever, streptococcal, pharyngitis, parvovirus, we have the pneumonia, pertusis, we have the influenza, diphtheria, epiglottis, rubella, we have the mumps, we have the meningitis, and adenovirus. The easiest way to remember this one is Spider-Man. So as the S for Spider-Man, we have 3 S, which is the sepsis, the scarlet fever, and the streptococcal pharyngitis. And the P, we have the 3 P's. We have the parvovirus, B19, we have the meningitis, pertusis, and I stand for influenza, we have the D, diphtheria. We have E as in epiglottis. We have R as in rubella. So you've already known the spider like that. So the man under the spider, we have 2M, which is the mumps and the meningitis. We have the AN for adenovirus. So the precautions to take for clients with droplet precautions is putting the clients in a private room or cohorting with other clients with the same precautions or disease condition, and also wearing the nurse needs to put on a mask when taking care of this client. I hope you understand the brief and easy way of remembering this precaution. We'll look at the standard precaution, the droplets, airborne, and the contact precaution. If you find this helpful, kindly subscribe to my channel and do look out for a new video. I'll see you in my next video. Thank you so much.